Good afternoon, everybody.
Good afternoon, everybody, and Irina.
Dr. Berger, you just came from obesity management conference, and there were a couple of diets people spoke about nutrition. What is the best nutrition you would recommend to our patients?
So this is a question that I'm often asked. So yes, we just came back from the Obesity Medicine Association conference in Denver. Talks about multiple diets. Common diets that were mentioned were Mediterranean diet, keto diet, a whole food plant-based, or even vegan diet. But what I tell my patients in one sentence, although there's really much more nuance to it than this, is that it's the healthiest diet that any
Works
patient
for
would like enough that they would adhere to it. But of course, there are different benefits and potentially downsides to each of those diets. All three of them can cause weight loss. All three of them can improve some metabolic metrics, such as blood sugar. Cholesterol, however, is one that could potentially be an issue with the ketogenic diet, because often people are consuming more saturated fat than they would on the other two diets, the Mediterranean or vegan. And in some people, their LDL cholesterol, which is the type of cholesterol that we're more concerned about, can go up significantly. So in people on a ketogenic diet, I want to monitor their cholesterol closely. If there's someone who has a genetic variant that causes them to have very high cholesterol already, then I probably wouldn't recommend a ketogenic diet. But for most other people, keto diet is a perfectly reasonable choice. It's just that it's a very restrictive diet.
I remember there was a slide where they actually give you, a particular amounts that you can consume. Like, for example, only half of avocado per day, right? I mean, there were a lot of, how much cheese you can eat in ounces. And you would say this relates to cholesterol, just to make sure that,
Well, so we're speaking about the ketogenic diet here.
Correct.
Still, yes?
Mm-hmm.
So on the keto diet, yes, people may eat more saturated fat, and so that's things like red meat and lamb, beef, etc. Sometimes pork on the diet.
Shrimps, pork.
Yeah, but it's not so much about how much cholesterol is in the food. They really don't absorb a lot of cholesterol out of the food that we eat. A lot of it is converted from saturated fat to cholesterol in the liver. So those things like red meat, let's take as an example. If someone on the keto diet wants to increase those to bump up the protein that they're getting and so forth, I'd want to know their cholesterol history, not what their labs are at the time they come to me, but have they had very, very high cholesterol in the past, things like this. So in general, what their history has been with regard to high cholesterol. In terms of the other foods, avocado, the example that you gave, is high in unsaturated fat, or what people call the good fat or healthy fat. So not going to be so much of a driver of cholesterol, although fat is more calorie dense than the other macronutrients, protein and carbohydrates. So in terms of weight loss, sometimes not having too much fat in general would be a good idea. So even avocado or olive oil or things like that, which are large components of the Mediterranean diet. But keto can reduce weight significantly, definitely control blood sugar. So if we're talking about a patient who has issues with blood sugar in some way, it can be a really good choice. And of course, in general, I'm recommending to everyone to avoid simple sugar and refined carbohydrates, things with white flour, not too much white rice. So your bread should be multigrain. Your pasta could be a whole wheat or a chickpea or a lentil, things like that, just to avoid the more refined carbohydrates. So white flour, things high in sugar. Also need to watch here and there things high in fructose, fruit sugar as well.
What about eggs? Like, one day we hearing that eggs good for you, another day we hearing that it's not good for you because of the cholesterol. Like, what are your thoughts about eggs?
Well, as I mentioned a few minutes ago, the current thinking on cholesterol is that you don't really absorb a great deal of it from the food that you eat. Most of the cholesterol absorption that goes on in the intestine is actually to recover the cholesterol that's in your bile that's secreted when you have a fatty meal, because the body has invested a lot of time and energy in putting that cholesterol into the bile, so the body would like to recover it in terms of efficiency. But the majority of cholesterol that's exported from the liver into the bloodstream, and that is the cholesterol we worry about, the cholesterol we look at on blood work, is created in the liver from saturated fat, or indirectly from a big sugar load, so let's say from a can of Coca-Cola, which overwhelms the liver, and all that sugar can't be converted into something called glycogen, so the excess gets converted into fat, which can then be converted into cholesterol. But to answer your question about the eggs, basically I'm not very strict about egg intake, because I think it's a good source of protein. They aren't terribly high in saturated fat, and I'm not so worried about how much cholesterol is in them. So, not to give people a hard and fast number that they're going to take down and hold me to, but if you're going to have 10 eggs a week, something like that, I really don't have a big problem with that.
Okay. And what about the I also heard a lot about culinary kitchens in the medical offices. What are your thoughts about culinary kitchens?
So culinary medicine is kind of a new thing in a way in lifestyle and obesity medicine. Basically, it's teaching people how to cook healthy meals. So people sometimes could really use a hand in terms of learning how to work with the healthier sorts of ingredients and make meals that are going to be better to control their weight or their other metabolic parameters and so forth. So some practices, perhaps ours will in the future, offer actual training courses, either virtually or they actually have a teaching kitchen in their office to give people some instruction in terms of actually learning how to cook healthy.
Are you planning to incorporate this into Northeast medical practice? And what is the program, your weight management program looks like right now?
Okay, so to answer the first question, it's something we're considering, but we do already offer individualized meal planning for each of our patients within our weight management program. So right down to me providing them with actual recipes and photographs of what the recipe ought to look like if you cook it properly. And so that's really individualized for the person. So it's not only what I think would be the healthiest things for the patient to eat, but there are recipes that they would actually be interested in eating. So together we come up with a plan for nutrition. Some of the other things that we offer, so we're in the midst of implementing an exercise and physical activity program that we're going to have trainer and or exercise physiologist to work with our patients virtually to help address that pillar of lifestyle medicine. And of course, our certified health coach, yourself, we offer our health coaching through the office as well.
Behavioral change.
Right, to help people change their habits. And just to circle back to diets again, the Mediterranean diet was talked about an awful lot, and I'm a big proponent of it, frankly. For people who are interested in eating that way. Just in broad brushstrokes, it's the way folks around the Mediterranean have eaten for thousands of years, and studies were done back in the 60s to demonstrate from several of the countries around the Mediterranean and look at people's cardiac risk and so forth, that it can reduce, and then in clinical trials later, it can reduce the risk for heart attack and stroke by 30% and onset of diabetes by 40%. So it can be very effective. It doesn't restrict carbohydrates per se, but everything should be relatively unprocessed. A focus on whole foods, so plenty of fruits, vegetables, nuts, beans, seeds. In particular, almonds and walnuts are found to be cardioprotective, but the big thing that was found in the PREDIMED study, so one of the modern studies of the Mediterranean diet, the thing that reduced cardiac risk the most was use of extra virgin olive oil. So the first pressing, not a blended oil, and not other types of oil. Although I would say probably avocado would be number 2.
So let me ask you, the Sagittarians, right? I mean, living in Mediterranean. Do you think it more relates to their lifestyle, not stress, not working too hard? I mean, socializing, drinking wine, taking beautiful walks, like, and again, when you living in America, it's a different lifestyle. People are stressed out, dealing with making money, working, for organizations, and just life seems to be more challenging than with the slow paced environment where people socially connected and they drinking wine and they enjoying their life.
Well, yes, and the Mediterranean diet is really called the Mediterranean lifestyle. We were really honing in on diet and nutrition today, but yes, the benefits of the Mediterranean diet is really all the lifestyle that goes with it that you've alluded to. So we have the pillar in lifestyle medicine of social connection with friends and family. So having a sit-down meal that's of all of these healthy ingredients I talked about already. Maybe a glass of red wine. It's lower in sugar than white, but honestly, I don't think that there are such large cardiac benefits of wine that it's the glass of wine that's heart protective. I think it's the fact that you're having a sit-down meal, you're enjoying time with family. Maybe you're going for that typical Tuscan or Greek walk after the meal. And so it's the whole lifestyle, and all of that benefits in terms of mood, in terms of your physical activity. So it's not just about what nutrients are in the diet. That is correct.
So, in terms of organic food, right? I mean, some people say whenever I travel to Europe, I eat baguettes, I eat pastry, and I never gain weight. As soon as I come back, I'm eating carbs, and I'm just like my weight changes. In terms of, the food and nutrition, what would you recommend? Like, and throughout the conference, I heard that a lot of people they're using small farms that where they're trying to obtain organic meals. Can you elaborate and talk a little bit about that? What is your intake on the quality of product?
So I've heard this from multiple patients that they don't focus so much on eating what we would call healthy things while they're in Europe, but they tend not to gain weight while they're there. When they eat the standard American diet, they tend to. So I do think that things tend to be less processed in Europe, and the closer the food is to something you could actually recognize, the more healthy it's going to be for you. I can't really speak to whether the flour in their baguette on the streets of Paris is different than the flour here, but it may be. I think people are also much more active in Europe, and I think when you're traveling in Europe, you're probably on your feet all the time, walking around and seeing the sights and things of this nature. But in terms of organic food or buying locally raised food, certainly buying organic is going to decrease your pesticide exposure. It's going to decrease your antibiotic exposure, and you can't say that those are bad things. I do think they're good things. So if you can, and also community supported agriculture, for example, is one way to support a local farm. When you have a CSA in your community, you essentially buy a share for the season, and then whatever is in season and being harvested, you get a share of. So that's a way to constantly have very fresh produce. If they have livestock, also meat coming to your table. And I think fresh as possible, little processed as possible, and if you can, also organic, or somehow reduce the pesticide exposure and the antibiotic exposure, be beneficial. And the last diet that I wanted to talk about just briefly be the vegan diet. A whole food plant-based diet in general can be really beneficial. If you'd like to take it to the level of being absolutely vegan, I think that there are a lot of benefits in terms of the amount of fiber that's in the diet. It can definitely cause weight loss and help to control blood sugar and cholesterol in general. But just because there isn't any animal product in the diet doesn't necessarily mean it's healthy. You have to be paying attention to the same kinds of things that we've already talked about. Well, not only particular nutrients or minerals and vitamins, but it has to be high quality, relatively unprocessed food. You can have a lot of packaged vegan things that are, so processed that they're really not healthy. Can of Coca-Cola is technically vegan. For Oreo cookie might be vegan. This kind of thing. It makes sense, but sometimes folks who are on a vegan diet, they don't pay so much attention to how processed their foods are.
From your experience working with the patient, how sustainable the plant-based diet is? Like, I understand people might go for a month, 2, 3, but in the long term, how sustainable people, have tendencies of keeping?
It really depends on the patient. Some people, for social or animal rights reasons or what have you, they really want to be vegan, and those folks can usually adhere to it pretty tightly. People who are trying it for health, it varies. It really depends on the person, the same as exercise. Can somebody keep up a vigorous exercise program 6 days a week? Yes. Can everybody? No. So it really depends. There is data to support decreased cancer risk with less exposure to animal products. There is some debate about it, but the data look fairly strong for that. So adherence to any of these diets, just to bring it back to the very first thing I said, it really depends on what the patient's interested in. Some people are able to be very strict about their lifestyle in general. For other people, it's a bit more of a challenge, and we always need to meet the patient where they are. We might have some sort of idealized picture of what we would like their lifestyle to be as healthy as possible, but you have to meet people where they are, and sometimes people aren't ready or willing to take things to that extreme. And so we always try to have a patient-centered approach and not to be paternalistic, and basically come to an agreement together, something that we can both be happy, the patient and the physician, in terms of their overall lifestyle, or in this case, diet.
Yeah, and throughout the culinary medicine, right? I mean, it was a huge emphasis on cultural aspect, like when people get together and the family and the recipes that come from your mother or grandmother. It's really, really hard to, cross everything and just start with the greens and just plant-based.
Well, sure. If there are meat dishes that are, ethnically or just your family,
Sure.
To be eaten on particular holidays or whatever the case may be, to me, that's important too. That's the social piece, right? That's the social connection pillar of lifestyle medicine. You can always try to moderate how much of that you have at a particular meal, just like anything else. We all are human. We all need to live, and sometimes to enjoy a meal that might not be considered very healthy, can lead to some happiness as well.
All right, that was very informative. Thank you so much, Dr. Berger.
My pleasure. Thank you. And as always, if you'd like to learn more about Northeast Medical Practice, you can visit us on the web at northeastmedicalpractice.com. You can call our office 516-604-3418 to speak with us. And of course, all of the things that we chat about here in our videos are just for educational purposes. We have not, at least as of yet, formed a doctor-patient relationship, and if you have concerns about health issues, you should always see your physician without delay. Thank you. Hope to see you soon.
Thank you.